Joining me in the studio is Dr. Abiola Ido, the Executive Secretary, Health Facilities Monitoring and Accreditation Agency in Lagos. It's good to have you join me this morning.
Thank you.
Let me
Good
say
morning.
Happy New Year to you.
Happy New Year.
All right. Now, the concerns around the country and around the world of increasing number or rising number of infections of COVID-19 is basically very visible. But talk to us from the perspective of available facility. We've heard the federal government and even state government saying that they are running out of facility because the numbers are increasing.
Okay, so as an agency, our agency is called Health Facilities Monitoring and Accreditation Agency. What we do is ensure that facilities that want to participate in the COVID-19 management is suitable. So we go out, do assessments on biosecurity, biosafety measures, and then we also ensure that the infrastructural layout of the facility is properly delineated. There are green and red areas, meaning that clearly delineated infectious and clean areas, okay, that there is adequate ventilation. We know that COVID-19 is a droplet infection, and then also that the people who will be working in that facility are suitable and qualified, and as well, they would also be trained. And then we also want to see that the infection prevention control measures in the facility is top-notch, so that the healthcare workers don't get infected and then they don't pass it to their patients, and then also take it to the family. So in doing that, we have visited at least 31 health facilities for the management of COVID-19. I would not say all these facilities were approved, because it is one thing to inspect for the management of COVID-19. It is another thing to actually approve the facility. Currently, the state is, during the first wave, we had many facilities that were both state-owned and private, and when it appeared that the wave had gone down and we had stemmed the tide, the state government shut down most of the facilities, but then left two critical ones in case there are still one or two sporadic cases. So currently the state is ramping up the effort on reopening all those facilities that were closed down, and then we're inspecting more private facilities to participate in the effort to see that the coverage or care is expanded. As you're thinking about the treatment and isolation of patients, you also need to start thinking of the testing capacity. So for those who have symptoms, the tests are done at the government facilities. But if you are on a need-to-know basis, for example, you are required to bring the tests or the COVID-19 test results from work, or you want to travel, then you have to, visit the private facilities that are, so that at least there is enough for symptomatic patients.
Now, you mentioned the issue of training earlier on. It's about a year now, roughly a year now of COVID-19, especially in this part of the world. Now, doctors and health workers, have they received the adequate necessary training enough to say, okay, they are well aware of what and how to manage COVID-19?
Yes, I would say so, because training is not a one-stop thing. You have to train and continue to retrain, and then when you practice it, it becomes a part of you. So, for example, infection prevention control, there has been continuous training. During the first wave, what a farmer did, particularly for the private health facilities, was to visit the private health facilities on like sensitization on infection prevention control, We also distributed protocols on infection prevention control. We distributed IEC materials, information, education, communication materials on infection prevention control, and the proper hand washing, how to wear your gloves, your gown, your mask, and we also spoke to them about triaging. That means from the entrance of the facility, you sort your patients. So if you have suspicions, then you have an holding bay where you hold that patient and then do a test. If you are sure the person is not COVID-19 positive, then you take the patient in. Okay, so during the first wave, what TEFAMA did was sensitize about 1,372 private health facilities all over the state. But because of the second wave, we have started the sensitization round again to start, trying to encourage and build on the past sensitization that we had done in the first wave.
Now, when it comes to accreditation of facilities that would manage all of this, what do you look at? What are the ideals that should be in place for a certain facility to qualify to be accredited?
Okay, so I will first start by saying that we have categories of facilities that will manage COVID-19. So first, it could just be like an isolation center for suspected patients. It could be an isolation center for both suspected patients and for positive patients. Then you could also have a facility that would have like an high dependency unit or intensive care unit.
These are all categories?
Yes, they're all categories, but they can also be interwoven. You can have one facility have everything depending on their capacity.
Right.
Okay, so you can also have testing centers like laboratories and sample collection centers, depending on what the provider wants to do. So, and then it also, we have certain criteria. We have like formats or that we take out to, and then it is not done only by a farmer. We include those who are specialists in the field. For example, those who are specialists in biosafety and biosecurity issues, like the laboratory pillar of the EOC, the Emergency Operations Center of the management of COVID-19, usually comes with us on these visits. And then LASEAMA, it's called an agency of government, Lagos State Infrastructure and Asset Management Agency. They also come with us. So they advise on the design and layout of the facility to ensure that...
So what do you look out for? What should, for instance, a testing facility or a testing laboratory, what must they have?
Okay, so the first thing for a facility is that you must be registered with a farmer.
Okay.
That is registration. And then, of course, we do not foist that desire on you. You have to have the desire and the intent. So you state your intent to the Honorable Commissioner. And then, of course, we ensure that you have proper biosecurity, biosafety measures. You know, I'm really not an expert on biosafety and biosecurity, but biosafety just means that for public health reasons, you do not accidentally expose either the people or introduce the pathogens. In this case, it will be COVID-19. And for biosecurity, it means that you do not deliberately introduce or expose either your workers or you want to, maybe in terms of the physical nature or to the persons that you want to introduce the pathogens to either the external environment or to the people who are working with you. So that's what biosafety and biosecurity measures are in a
layman's understanding.
Yes, in a layman's understanding. So, but apart from biosecurity, biosafety measures, the facility has to be very well ventilated. Yes, ventilation is very key, of course, properly illuminated. And we also check for the public health facilities. For example, they have to have adequate number of bathrooms and toilets for the patients. And for example, if it's going to be a facility for suspected cases, it's better they are in rooms so that each room has a facility of its own. And there is no risk of introducing infection to the next patient. And then of course, I also said that we also look out for the capacity of the persons. So they must be qualified to practice what they are practicing. So for example, they must be doctors who have enough experience in taking care of patients who have emerging pathogens like COVID-19. And then training. Before we finally approve a facility, the staff would have trained on infection prevention control measures and other.
All right.
And then for a laboratory, sorry.
No, go ahead, because
okay.
we're getting information. The idea is for people to know how these things work.
Okay.
So as you're reeling them out, of course, we're picking the points and understanding how that sector works and how you interface with people. So go ahead.
Okay, so for example, a laboratory, the gold standard for testing in Nigeria, Lagos State, is having a polymerase chain reaction machine.
Okay.
Yeah, so you have to have a PCR machine. I didn't want to just say PCR without telling you what it means. I'm not a laboratory scientist.
Well, the point is, when it comes to the names of all of those, when you mentioned them, we just sit down and say, okay, Shebi is a machine.
Yes, it's a machine for testing. Okay, so you have to have that for you to be, and then of course your laboratory, because I have to keep reeling biosafety, biosecurity measures, because the pathogens can become hazards.
All right. Now, how in your as you move around to ensure that facilities and all these organizations comply with the standards, has there been instances where you came across some facility and you had to shut them down because it didn't comply?
Yes. Yeah, in some instances.
Okay.
Because of the nature of COVID-19 and the fact that if you are not careful, you can have every health worker in the facility come down with COVID-19 and then also spread to their families, their neighbors and things like that. Yes, we have instances where we close the facility. If a facility has not been approved for the management of COVID-19, it is best to nip that practice in the board. And then if they are actually interested, we give them the criteria for coming on board.
And they have to meet such criteria before they begin to practice.
Yeah.
Talk to us about the availability of PPEs and all of those equipment, safety equipment that needs to be in place as well, because there were talks about the shortage of PPEs, shortage of other equipment like oxygen cylinders and all of that.
Okay, so there was, okay, let me first start by saying that for PPEs, there was a shortage, and there is still a shortage worldwide. It's not only Nigeria, because of the need of, there's a great demand. Then apart from the fact that there's a great demand, initially there was hoarding, and then there has been like a minor breakdown in the supply chain, for some of these PPEs that are imported. But be that as it may, you cannot, for example, want to manage COVID-19 without protective equipment. Yeah. So for all facilities willing to manage COVID-19, both public and private, there is at least adequacy of PPEs. Yeah.
Now, another concern is the issue of, like I was saying earlier, is about a year now. What efforts are there to begin to source for these things locally? Are there agencies or companies that are able to produce these things within Nigeria that the government is trying to liaise with or try to engage?
Yes, I am aware that during the first wave, just before the end of the first wave, that some, I think some private companies started producing in Nigeria, and then even, I think even the state government, and then, you know, because of the innovations, many of our secondary health facilities started producing, for example, hand sanitizers and things like that. And I am aware face masks are made. We have face masks that are made in Lagos.
Of course.
Yes.
In fact, many tailors now make face masks, apart from the clinical ones.
No, even the surgical ones.
Oh, I agree.
Some of
That's
them.
amazing.
Yeah, they're made in Lagos.
All right. Now, the one other concern now in the minds of a lot of Nigerians are the issue of fake vaccine.
Okay.
That is a great concern now because authorities came to say that people should be aware, should be wary of the availability of fake vaccine. What does your agency do in such a way? Is your agency considering, you know, keeping an eye as well, as long as maybe NAFDAC and other agencies are? How are you collaborating to ensure that that doesn't happen? Okay,
so for the issue of vaccines, it's usually under the purview of the pharmaceutical services. But that is not to say that we do not work together. So, for example, a farmer visits a health facility and then we see that, because our purview as an agency is health institutions, but that's excluding pharmacies. So if we visit hospitals, clinics, and we see vaccines that has not been approved by NAFDAC, because currently NAFDAC has not validated any vaccine for Nigeria. Yes, we would actually shut the facility down.
Okay, all right. Now, the another area I'd like us to talk about is the issue of the facility you talked about earlier. Now, isolation centers, a lot of them shut down, like you said. Yeah. But what we still say, we still hear that enough testing is not going, adequate testing is not going on right now when it comes to comparative to the demand on you know, the call for testing. What has been done in that regard? What are you hearing, and what are your sister agencies doing to increase capacity and also increase collaboration with private organizations?
Okay, so as I told you, we also inspect and approve private laboratories. Okay. But the private laboratories are basically for those who want to do the test on a need-to-know basis. Like, you think, I want to travel. If you're symptomatic, you still need to use government facilities. Because,
well, why not private facilities as well? The ones that you trust and have confidence in.
Oh, well, if, yeah, you could, but I guess the rationale is that for the government facilities, the testing is free. So if you are symptomatic, you do the test at government facilities. It's free.
But it's obvious. But it's obvious the government facility can't cater for everyone.
That is why it is for those who are symptomatic, and that is why government is trying to expand the private facilities for those who want to use it on a need-to-know basis. If you want to say, for example, I want to travel, you can use a private facility. But you are symptomatic, you don't need to pay for the test, because some people will be afraid, I can't afford the cost of the test. But then you don't need to pay for a test if you are symptomatic.
All right, we have to leave it here now. Thank you, Dr. Abiola Ido, the Executive Secretary, Health Facilities Monitoring and Accreditation Agency. Thank you so much for coming on the program.
Thank you so much for having me.
Right.
Yeah.